Thank you for checking in with 10 Questions with NBC 10 Boston. I'm Kwani Lunis, and this month we're spotlighting women who have been making a difference in their respective fields. Today we have Dr. Cheryl Clark joining us. Thank you for spending some time with NBC 10 Boston.
Thank you so much for having me. Great to be
Absolutely. Of course. How's your day been so far?
It's been really great. It's been a fantastic day just to think through the research and the work that we're doing. So yeah, always a great time to have a conversation.
Absolutely. And I definitely want to get to the work that you talked about in a few minutes. But first, I want to start with your career itself. How did you get into the field of medicine? What was your inspiration?
Yeah. So I think for me, it really was about how I grew up. I'm from a place called Harvey, Illinois. It's south of Chicago, so I'm a Midwesterner. And I grew up with just such powerful women. Just thinking about my mom, men are great, and I had really great men and women in my life, but just really powerful women. My grandmother and all of her sisters, and it was really just wonderful people who encouraged me and who asked me questions, asked me about what I'd like to be, and so it was just really important to have those kinds of influences. What I would say is that we also had illness in our family. My beloved cousin, who was really like a sister to my mom, Bernice, passed away of cancer of the pancreas. And it just really made me want to go to medical school and take care of my family and be a resource. And so I wound up getting into medicine in part because of that.
And excuse me. And you meant, okay, thank you for sharing your inspiration, first of all, and I'm sorry for your loss. But you mentioned the way that women have been an influence in your life throughout your career. I mean, when you look at really any industry, it is very much male dominated. Did you find at times that it was hard navigating when maybe sometimes you found yourself being the only woman in a classroom or even in a room of research?
Absolutely. And I will also just put out there that I also identify as being a woman of color. I identify as being African American, and I think that's an important dimension, of my experience. So I went to both undergraduate and did my master's in medical school and on the West Coast at Stanford University. And it was interesting trying to figure out how to navigate these environments. And I would not be a doctor today if it weren't for two women in particular. So a physician's assistant named Rebecca Pinto offered to be my mentor and help me through my honors thesis and all that work. And Dr. Linda Giudice gave me my first experiences in research and led me on the path to becoming a physician who sees patients, but also a researcher who could ask questions. And so women have been there for me every step of the way and really have been essential to me moving forward.
Why is mentorship so important, especially when you're a woman of color in a field like medicine?
Yeah. I think you can be talented, you can be curious, you can have all of these, great characteristics, and you still need help figuring out how to navigate. Where do you go? How do you get your work sponsored, funded? How do you think through that? So it's really important to have people who are ahead of you help bring you along. And likewise, if you can be a light shining for someone else who also is trying to go through that work, it's important to do that. So mentorship, both giving it as well as being mentored, so important.
And I think we mentioned giving it is important as well. I think a lot of times when people think of mentorship, they think, oh, you have to be like a 20-year veteran in the field before you can call yourself a mentor to someone. But for you, I don't know when you felt the need to finally identify as a mentor. When was the earliest time for you when you realized that you can start giving back?
I would say in elementary school. and I,
See?
and I feel it this way. It's the way that you put it, that you don't have to be some 20-year veteran, to
Right.
sort of reach out a hand. That sort of peer mentoring where you find a friend, you find somebody, even in, like in kindergarten. I remember having friends. We would sit together and sort of, do that sort of play. And I've carried that sort of spirit of playfulness and engaging. Peer mentorships is the sort of thing where you got to have that friend that you can call up and say, well, what do you think we should do about this? Or how should I manage that issue? So
Right.
yeah, I think no matter where you are in your career, no matter whether you're going through something, whether you're celebrating something, there's always an opportunity to reach out and to shine a light on someone. And I think that has been an important part of my career and my growing up.
Now, this question might be self-explanatory, considering that Boston is definitely a hub when it comes to medicine. But I want to know personally for you, how did you make your way on the East Coast and specifically working in the Boston medical field?
Absolutely. And so I should talk to you a little bit about the kind of work I'm interested in.
Absolutely.
So I am a hospitalist, internal medicine physician, and I see patients who are sick enough to be in the hospital. But I'm also what's called a social epidemiologist. And so I'm interested in not just kind of how healthcare is delivered, but how does our social environment, so where we live, where we play, but also things like structural racism, sexism, how do these really kind of social factors influence our health? And when I was thinking about pursuing a scientific career, I looked around the country and saw many places where I would be interested in doing study. But in particular, I saw a woman named Kamara Jones, who was at the Harvard School of Public Health at the time, who was studying many of the things that I was interested in studying. And so I just was bold and I just sent a note, and then I applied and I wound up getting into the school. And there were so many people there. Who were just great thinkers and helpful. And so I came to Boston initially to do my public health school and to study with those folks. And I wound up also what we call matching. Actually, for those who know about how you become a doctor and how you get assigned to a hospital, there's a process. It's called the match, and it's happening this week. And I
Yeah.
wound up matching at this hospital, Brigham and Women's Hospital in Boston, and just found a ton of mentorship and really good people to work with. And so I've stayed. So that's how I wound up here, and that's why I continue to be here.
That sounds amazing. And you mentioned the work that you do, and you mentioned the public health aspect as well, because a lot of times when you think about public health, it is, I think, at its core, supposed to cater to the people that may not have the resources, generally speaking. When you look at your public health program or other people that are currently studying, the mis inequities really of marginalized communities, have you seen a lot of diversity when it comes to the people that are working side by side with what you're doing, or is it still kind of harder to see that?
That's an outstanding question. And I would say that there's sort of a mixed answer to it. I think that we can do better. Recently, a lot of public health research is funded through what's called the National Institutes of Health. It's one of the largest organizations that funds research and sort of supports research in our country. And really exciting that over the past month, the National Institutes of Health has really come forward and said that we need to not only study structural racism, we need to study conditions and situations that lead to good health and poor health for diverse populations. But we also need to support the researchers and make sure that we have a diverse group of people who are bringing their talent and their perspectives to the work. And so I think that there's a lot more that we can do in the field to bring both clinicians. Only about 5% of clinicians, for example, physicians and clinicians seeing patients are African American. I think 3% of those are, or 2% are women. But we also need to make sure that researchers, people who can ask these scientific questions, are also supported. So really critical, and good to see that there's been some movement to make that happen.
And fast forwarding to your work specifically, I'm not sure, this past year, I'm sure has been a very hard time for everyone, but I know the medical field definitely had, I'm sure your workload probably increased a little bit. You have a lot of work when it comes to equity, and we noticed that when we looked at the coronavirus cases, that a lot of, like I mentioned, the marginalized communities were not receiving the proper health care that they needed, or at least not in a timely manner. So for you, what has the last year looked like? And how has maybe your workload increased as a result of this pandemic?
Yeah. I would say that, similar to a lot of physicians and a lot of people, obviously this past year has, completely changed our lives. And I mentioned that I'm what's called a hospitalist. So I see patients when they're in the hospital, and we are one category of physicians who were on the front lines for COVID. I, for example, was in the COVID unit taking care of patients diagnosed with coronavirus, with COVID-19, at the very beginning of the pandemic in March. And in Massachusetts, I was on during the peak in April. And it was possibly one of the more harrowing moments of, I think, my career, certainly all of our careers, to be with patients when initially you had to be very thoughtful about our protective equipment, had to be very thoughtful about keeping our families safe, keeping our patients safe, and thinking about how we would manage this disease when we had very few options. And so it was a really it was a time that increased like workload, emotional workload, all of those sorts of things. Um, but I say that I think it was also a time of great growth. You start to realize that as a physician, part of what you do is you give medicines and you help people to feel better. But part of what you also have to do is draw on your humanity and really be there for people. Even if initially, when we didn't have the medicine and we didn't know what to do, we had oxygen and we had our words of comfort. We were able to make sure that patients got a chance to call in at least and hear their families' voices when that was possible. And so it really I just there isn't enough that I can say about the families, the patients, and everything that they had to go through, but also my colleagues and how just how important it was that we all were there for each other. It was a singular time in our history.
Right. And work aside, when you were able to step away, I'm not sure how often you were able to do that. How did you personally take care of yourself? What was your self-care method?
Yeah, so I am very lucky. I have a family and have two little ones, and my spouse, my husband, and I think it was really spending time together. We were very good about lockdown and very good about spending time together, and so it was about just those personal moments that you can find. Sitting together, telling stories, phoning people, making sure that nothing went unsaid in terms of expressions of love and care for each other. So those were for me the moments that I'll remember and cherish.
I love that you mentioned your family because I don't think I've asked any of my other women this month this yet, but I'm very curious. And you don't have to go into like personal details or anything. But when people look at women in any professional field, they often assume that if you do have a family, then you're gonna have to eventually abandon your career or vice versa. So for you, how have you been able to navigate, still having a family, but also being very successful in your career?
I would say that I am successful because of my family.
Mm,
It has been just amazing to have a wonderful and supportive husband, to have children who are my absolute joy, and having that kind of balance, I think, really helps you to balance out days where perhaps either for me, not experiments, but the data that you're looking at. Does that make sense? You need to take a break, and just having a really full life has been, I think, a great addition and a great way of helping me to to think through and to weather small challenges that might happen at work. So I really appreciate asking that, and I appreciate the opportunity to talk about it. I think that women, we often do have additional responsibilities with related to childcare or related to family responsibilities, and so it's a big part of life, and it's really freeing to get a chance to just put it out there and talk about it. And I think it helps other people too, just to be able to normalize that and know that that's a part of who we are.
Thank you for sharing that. And I think this last year has definitely, if not escalated, people understanding, especially the men now that if they had to be at home, like, oh, this is what my wife was dealing with, or how did she balance doing all of this and still
Right.
being able to come home from work and still seem sane at sometimes.
Our cooking skills have improved. Both.
Looking forward though, we're still obviously in this pandemic. People are finally getting vaccinated, but it looks like it's going to be a little while before we go back to whatever this new normal looks like. From your sense and specifically your research, how do you think we should be moving forward when it comes to the way we navigate everyday life and even, the maybe the changes that have been made so far that we might either keep or decide to go back to?
Yeah. I would say the top 3 things are vaccinate, vaccinate, and vaccinate. I think it can't be overstated that, one of the ways that we will, be able to get back to, being able to be with each other again is to make sure that, we have enough people, in our country who have taken the vaccine. And Yeah, we know that there are, at this point, 3 vaccines that people can take. They all are very effective in terms of helping to prevent very severe disease from COVID-19, and so that's going to be an extremely important piece of this. And I think also we should innovate. We should be thoughtful about what it means to return to a quote unquote normal. We have learned a lot about how to interact with each other over platforms that are digital, but we also need to make sure that as we make those kinds of changes, that we don't leave people out. So there are many people, not just in sort of life and work, but even for me, in any case, in healthcare, where we have to think about what kinds of technology should we be using. Is it okay to see a patient over the telephone? So as we open up what a new normal looks like, I think it's important for us to think through the things that we want to make sure that we don't bring with us. These kinds of inequalities and inequities that can come when our society changes in ways that doesn't bring everybody with us. And I think we learned so much from what we've all been calling, I think, the twin pandemic of structural racism, and how we make sure that we create the opportunities for everybody to be able to live healthy lives and to benefit from the good parts of society. And so all those things I think will be important as we open up what new normal looks like.
And tied into that point that you mentioned about this double pandemic and the inequities, and I know you're very passionate about doing research when it comes to figuring out why there are so many inequities. You mentioned the vaccine, and I feel like right now it's twofold because maybe a lot of these Black communities aren't getting the vaccine or being, given the privilege to access it. But at the same time, there are a lot of people in the Black community that are hesitant to take it because of maybe research that they think they've done, or, maybe historical implications of what a vaccine could mean as a person of color to take in this country. From your standpoint, your professional standpoint, why is it so important specifically for people of color to be maybe trusting of the system and the science in taking this vaccine?
Yeah, fantastic points. And I would say that, I just think back to my experiences back in March and April, and I saw what our hospital looked like. I saw brown and Black people, in our hospital ill, and I never want to see that again. I never want to see that kind of disproportionate impact. And the vaccine is one of the ways that we are going to be able to protect our communities. And so it's just so important to make sure that everybody has access. And I also appreciate, the discussion that you bring up around the history. We can't ignore, the history about the way that experimentation and that African Americans in particular in this country have endured and have had to push forward with that kind of exploitation in honest terms. Um, Even thinking through that history as we talk about what it means to get vaccinated, we have been talking a lot about this idea of vaccine hesitancy, the idea that many of us may not want to get the vaccine because we're worried about it. But I also think that we need to have this conversation in terms of vaccine and healthcare access. We have to make sure that we provide the vaccine and education in places where our communities live. And as we have that conversation about getting vaccinated for coronavirus, we also need to make sure that people also have access to flu vaccines. They have access to healthcare in general. And so this is a conversation I think that can't be reduced to just one issue of hesitancy. We really need to have this conversation in terms of how we really broaden healthcare access and make it work for everybody. And I think issues like trust work themselves out when healthcare systems are trustworthy.
And final question for me. I know your work is far from over right now, but when you eventually look back on the work that you've done, even during this unprecedented pandemic, we've used that word so many times this past year, what kind of impact do you hope to have on not only the field of medicine, but maybe just in your everyday life and the people around you?
Yeah. And I wanted to talk about a research study that we are doing, which I'm really proud of, the All of Us research program. Part of what has come up, I think, during the pandemic is that we really have so many questions about how how both coronavirus, but how other health conditions are different in different populations. And the National Institutes of Health launched the All of Us Research Program in 2018, and it's, I think, really a powerful opportunity now to do this kind of study. The study is enrolling 1 million people over a course of several years, and it's providing information on people from all walks of life. So it'll allow us to look at not just one condition, but many conditions. And so I'm really excited about the opportunity to have people join the program, to conduct research that helps us to think about what we need to be doing to protect people, to improve health. And All of Us is a great way of doing that. And so you can go to allofus.org or Google it and find us at our website. In New England, Boston Medical Center and Brigham and Women's Hospital have come together, and Mass General Hospital have come together to offer this program to folks who live locally. And it's one of the things that I'm hopeful for, that ultimately we're going to, in healthcare and research and medicine, really embrace equity and diversity, so that we all get to live our best lives and in our best health.
Thank you so much, Dr. Cheryl Clark. Thank you for joining 10 Questions with NBC 10 Boston this month.
My pleasure.